With me now is Adam McMullen, who is the CEO of AvaSure. Adam, welcome to the conference. I hope it's been a good one for you.
Yeah, it's been a fantastic opportunity to meet with not just our customers, but also a tremendous number of potential partners.
Yeah, there's been a lot of conversations going on for sure. Let's start with you defining what AvaSure is.
Sure. AvaSure is the most widely deployed intelligent virtual care platform for health systems. We really help health systems address the labor shortage, cost pressures, and improving their results by having a highly reliable platform for audio and video and AI, and it's all enabled with AI to help reduce sitters, to help provide virtual nursing, to help connect families into key moments of care, and to better leverage your scarce nursing workforce cross country.
Give an example of how you've actually seen that work.
For sure.
Metric.
Yeah, community health systems, one of the largest public health hospital chains, benchmarked AvaSure against our competitors and found that we had the most dramatic results in reducing falls. And they now rolled that out to 40 hospitals. We take 16 virtual sitting roles, turn them into one, and help customers do something less expensively with dramatically better results. And then those resources in turn are then returned back to your nursing teams. For
the customers or systems who may feel a little bit of apprehension, what is the barrier to entry to transfer over to this technology?
There's a lot of noise in the market right now, a lot of noise around what AI could do, and virtual nursing is something that is on the top of the mind for C-suite leaders because of the structural nursing shortage.
Yes.
Many of the wisest, most experienced nurses have retired. They want to find ways to re-engage them. So virtual nursing is, exciting. You got the AI noise. People kind of, step back and say, where do I jump in? How do I get going? And that's where we've created an adoption model that allows you to start with virtual safety observation and then move into virtual nursing. And as you move from step to step to step, each time you're unlocking new clinical outcomes and funding the next step. So, we all know that health systems are right now challenged in ways they've almost never been challenged before financially. And we've got a pathway to really help them adopt virtual care so that it saves them money, gets them better results, and really and ultimately starts to bring some of the joy back to nursing. That is a really tough job. And we need to find ways that are really clinically led and technology enabled to make the job better.
A huge point of conversation at this conference has been about AI, and I think there are very obvious ways that AI is used. Can you talk about how AI gets incorporated with your technology if it's used at all?
Absolutely. So at AvaSure, we're helping our customers build virtual care centers. And the first thing we want to do with AI is provide additional levels of safety. We really want to augment people that are observing patients and provide that layer to say, hey, a patient's about to get out of bed or a patient might be leaving the room. That's layer one. Layer two would be to make the folks in the virtual care center more efficient, to where if a patient was at rest or had a lower cognitive burden, you could observe more patients to support them. Level three, in some cases, there may be some automated alerts. We do a lot of work in the technology. We're not there yet, but to know things like if no one's rounded on a patient or is an IV bag empty or did a tube fall. So seeing some really neat things there. And then on the voice side, caregiver violence is it's gone off the charts. It's super unfortunate. And we're looking at ways in our next release to really look for words that would signal violence or someone needs help or an escalation in a situation in a room.
Wow, that is super interesting, actually. In the news recently, there has been a lot of talk about cybersecurity, change healthcare, which has been catastrophic. When you are reading that as a CEO, how does it affect the way you think about your company?
We think a lot about the layers of defense. At AvaSure, one of the things we do in building our system is we also develop hardware that is hardened from a cybersecurity perspective. We manage all the firmware, we test to that, we're pushing out updated software so our customers don't have to do that. So we can consistently deliver something that is highly secure into the health system environment and then appropriately layer additional security on top of that.
And finally, can you paint a picture or present a moment, a beautiful moment that your virtual nursing platform has procured as a result of the work that you're doing?
You know, we work very closely, as an example, with University of Colorado Health, UC Health, and they have adopted virtual nursing in a way around virtual deterioration and sepsis management. It is incredible the results they've seen across their entire network. They have a dedicated team of 4 to 5 nurses, 24/7, managing these sepsis patients. If you're a nurse, you don't see them that often. With this dedicated expertise, they believe that 1,000 more people walked out of their hospital last year than the year prior because of the better care and the reduction in harm.
And the personal nature of it too.
Yeah. Well, those are 1,000 people that get to really attend, weddings and, other family events and community events that otherwise wouldn't have.
That's so awesome. Adam, thank you so much for being here. Have a great rest of the conference.